Hey guys, I'm Kristen Gumpf and I'm a PA specializing in men's health, and we are going to start our Straight Talk series discussing Peyronie's disease. It's estimated that around 10% of men in the US may have Peyronie's disease, but unfortunately the majority of these patients are not getting accurately diagnosed and continue to suffer in silence. Most men end up getting diagnosed with erectile dysfunction, whether it's the patient not knowing or the provider not asking the right questions, but not every penis problem is erectile dysfunction. An accurate medical history and physical exam are crucial. I have treated Peyronie's disease for almost 10 years, and it can be a very difficult journey for both patients and their partners, but I do want people to know that there are treatment options. First, let's discuss the basics of penile anatomy. The penile shaft contains 3 columns of erectile tissue that become engorged with blood during arousal. The corpora cavernosa are 2 columns on the dorsal or top side of the penis, and they fill with blood during arousal, leading to an erection. Then you have the corpus spongiosum, which is a single column running along the underside or ventral side of the penis that surrounds the urethra. Then you have the glans penis, which is the rounded head at the tip of the penis. It's highly sensitive due to many nerve endings. And then you have the urethra, which is the tube that runs from your bladder to the tip of your penis, through which urine and semen can pass. Then the foreskin is a fold of tissue that covers the glands in uncircumcised males, providing protection and lubrication. The corpora cavernosa are composed of spongy tissue that becomes engorged with blood during sexual arousal. Then you have the tunica albuginea, which is a fibrous layer that surrounds the corpus cavernosa on either side, and this helps to maintain the shape and rigidity of the erection. This structure is very important for Peyronie's disease. The corpus spongiosum runs along the underside of the penis, surrounding the urethra, and its primary role is to prevent the urethra from collapsing under the pressure of an erection so that semen can flow through the urethra during ejaculation. It does become engorged with blood, but less so compared to the corpora cavernosa, and the glans is also an extension of the corpus spongiosum. The blood supply is obviously crucial for function of erections. You have the dorsal arteries, which run along the top side of the penis and supply blood to the skin, glands, and surrounding tissues. Then cavernosal arteries run into the corpora cavernosa and are responsible for a majority of the blood flow during an erection. You also have helicin arteries, which are smaller branches that arise from the cavernosal arteries and allow more blood flow into the erectile tissue. The blood that fills the corpora cavernosa and corpus spongiosum is trapped during an erection by veins that constrict, preventing blood from draining away. So the venous system, especially the subtunical venous plexus, plays a key role in maintaining the erection by limiting the outflow of blood. How I try to explain it to patients too is think about trying to fill up a cup with water, but if you have a hole in the bottom, it's never going to stay filled. Lastly, the nervous system also plays an essential role in the function of the penis, both for sensation and the physiological processes involved in an erection. This can be affected by other medical conditions, injuries, and medications. The pudendal nerve is the primary nerve involved in sensory and motor functions related to the penis. It originates from the sacral region of the spinal cord and provides sensation to the glans, shaft, and surrounding tissues. It also controls motor functions such as contraction of the muscles involved in ejaculation. The sympathetic and parasympathetic branches of the autonomic nervous system are involved in the process of erection and ejaculation. It's a bit of an oversimplification, but generally your parasympathetic system controls erections and sympathetic controls ejaculation. The internal anatomy of the penis is a complex interplay of erectile tissues, blood vessels, nerves, and internal structures that work together to achieve the process of erection, sexual function, and ejaculation. For most men, you probably don't think twice about how this process works until it doesn't. So join us next time on Straight Talk to discuss scar tissue formation in Peyronie's disease.